Good afternoon and welcome to our educational webinar, The Current State and Future Outlook on the Sleep Tech Profession, a 5-year retrospective. Thank you for taking time out of your busy schedules to be with us today. My name is Rachel Bohr and I'm Enso Data's Director of Marketing. Before I introduce our speaker, Andrea Ramberg, I have a few instructions. We have over 100 people on the webinar, so you are on mute. However, if you have joined us on your phone, I would also like you to mute your phone just to make sure we don't get any extra noises in the background. And then also we will have some time for Q&A after Andrea's presentation. And I think Andrea wants to get some questions during the webinar as well. So if you have questions that come up or if you have insights that you'd like to share, feel free to put those in the question panel on the right side of your screen. And we'll try to get to those throughout the presentation and then also have that dedicated time at the end. And just a reminder, although we do typically host around 4 to 5 webinars for CE throughout the year, this one is not for CSTE credit. So I just wanted to give everyone a reminder on that in case you were wondering. And now I would like to introduce Andrea. Andrea Ramberg has spent 15 years in sleep medicine, learning every component of polysomnography from clinical to administrative. She is double credentialed with her RPSGT and CCSH and holds a Master of Science in Industrial and Organizational Psychology. Andrea is Enso Data's clinical director, and she joined the team in 2020 because of her passion to bring sleep medicine into the future. Serving as the current president of the BRPT, Andrea's goal is to empower sleep technologists in new roles through the CCSH credential as sleep coaches, sleep educators, and sleep navigators. And with that, I will hand over the presentation to Andrea.
Thank you, Rachel. It's a pleasure being here today with everybody. I have to say, when I first came on the board and learned a little bit more about how the board operates and these credentials and all of it, I found myself just loving all the different data that came through and trying to figure out what can we find from this data and what trends can better help us in our careers in the sleep field and all of that. So as I go through here, I hope to be able to present where we're currently at in sleep medicine, a 5-year retrospective of where we've been the last 5 years, and then also where I see things going in the field. And I also, at the very end, will be talking a little bit about Enso Data products, just an FYI as we get through, because I think it folds nicely within everything that we're talking about. Okay, actually, Rach, you want to put that poll up real quick? Maybe not. We could just keep going until she catches up.
Oh, I got it. It's up now. You should be able to see it. Yeah, sorry about that.
That's okay. So we're just wanting to know which of the following best describes your current work environment.
We're at about 50%, so give a few more seconds.
And I'd be curious for answering other. If you want to just type in the question, just the question box, just type in what else, where you're working, if it's vendor, if it's industry.
All right, we're at about 75%, so I will close the poll. And would you like me to share the results with everyone?
Great, thanks, Rachel.
Okay, there you go.
All
so
right.
Yeah, 59% at the health system hospital. That's pretty amazing. All right, go ahead, sorry.
Okay. All right, perfect. So, and that actually kind of fits into where our survey showed us in the JTA 2022 RPSGT JTA survey. About 42% is at a university or hospital based on campus. That's actually up slightly from the 2017 survey. And then university or hospital based off campus is the next highest. The one where we saw a little bit of change within the field is The independent testing went down a little bit, which I don't think surprises anybody. I think as we see this shift in sleep technology, the independent labs have a little bit of a harder time competing with some of this new stuff. And then interestingly enough, the research actually went up a little bit, the research labs. So that's kind of cool to see the difference that where we're going in sleep technology is actually trying to find new and different ways and research different things. But overall, it seems like that university or hospital-based on-campus seems to be the majority. And that also kind of ties into what we're going to talk about later with our patient demographic is getting sicker. And I think a lot of labs are trying to make it safer for patients. The patient demographics that are coming into the lab need to actually have on campus and that support. All right, so when I was looking through this, it's a lot of data, a lot of numbers, but what does it all mean and what should we be paying attention to? So what I would love for the audience too is, as I'm going through some of this stuff, what are your observations? These are just something that, you know, as I was flipping through what I noticed, what trends I noticed, but I would love for if there's maybe something that I missed or maybe something that you're like, oh, well, this is what I would take from these numbers and this is what these numbers mean to me. I would love for people just type that in the chat or in the answers or the questions, I mean. Okay, so you hear me talk about this term job task analysis. And with the RPSGT, we're NCCA accredited. And what that means is we have to meet certain standards. We have to meet certain levels for when we test for the minimal viable candidate to sit for these boards. And what the job task analysis is it's a process done about every 5 years. And it's determining what people do under what working conditions and what knowledge and skill set they're using for that. So, you know, when you look at what's changed in 5 years, I mean, there's a lot that can change with what we do on a day-to-day basis. I mean, not only in our own careers, but just, I mean, think about what happened in the last 5 years. It's COVID, it's the CPAP shortage, it's a lot of things. And that really catapulted a change in our roles. In 2022, we had a little over 6,000 active RPSGTs take the survey. And 2017, about 6,800. So typically we have about 1/3 of techs that actually sit for that survey. So it's a good enough number for us to understand what are you doing in this field and where do we need to go? And to make sure that are we teaching our technologists what they need to be successful? Because if we aren't, then we're only creating more problems in our own lab. So when I went through this, I found 4 different key takeaways that I want to discuss today. There's the number of RPSGTs in the field is decreasing. I mean, I think every lab that I talk to tells you that, right? They have a trouble finding techs or that they just can't find them in their areas. And, you know, and we will address that today. There's an increase in technology resulting in uncertainty and change. And somebody in our audience, yep, but technology influence, but remains largely dictated by insurance coverage. I completely agree with that. I think there's an intertwined play with insurance and technology. And technology, though, technologists are hungry for career growth and education. So while we don't have as many, they are really wanting to advance. They're really wanting to find what else is in this field. And if I go into this field, where can I go with it? You know, and roles and technologies are evolving. We're seeing this with the CCSH credential. Everything is moving forward and techs are creating these new roles and it just looks a little differently. Okay, so the AST 2021 Workforce Survey, they sent this out and what they found is what we're seeing overall is there's a high number of aging sleep technologists in the field that are over 20 years. Their intention to leave sleep field is too high. About 27% are going to be leaving within 5 years or less. And that was again back in 2021. And then lack of new younger technologists entering the field. There was only 13% between 0 and 5 years of experience. So we're seeing this experienced demographic of techs who know what they're doing, who are really well or doing really well within their jobs, looking to leave the field because they're like, I want to retire. I mean, we all want to retire someday, right? But how do we combat that? How do we change that? Okay, so the number of RPSGTs, so you could see that it is slowly decreasing. It's not decreasing drastically, but there's enough from, so you look at 2021, we had about 17,307 techs, and then now 2022, we have about 16,705. And some of that is pointing towards what we discussed on the one before, is techs are getting older, techs are retiring, not a lot of new techs coming into the field. I think some of it is technologists, they see technology and they think, I don't have a future in this field. What am I even going to do? Do they even still need me in this field? And I hope to be able to dispel some of that and give you all tools and numbers to be able to come back to your group and your communities to say this is a very viable career option, not just for working nights, for multiple reasons. You know, and this is again what we came up with, age trends. So part of the job task analysis is surveying what age range and how many age ranges do we have within each. So you see that the under 24 market, that's pretty low. Over 75 is pretty low too. So the middle demographic, 31 to 62, is where we hold most of the technologists, and 51 to 62, those are the ones that might be looking at, you know, retiring in the next 5-10 years, and that is one of our highest, you know, groups. So part of what we are looking for is ways in which, how do we attract this younger generation? How do we ensure that we're making this a viable career option? Okay, and something that I get asked a lot, you know, as with the board, is you say that we need technologists, you say that we're in desperate need. I have a tech and they can't seem to pass the test. And how can we, you know, insurance dictates that we need an RPSGT to take care of Medicare. Well, my techs are not passing this exam. And something that was new to me when I came onto the board is the concept of a first-time test taker versus second-time test taker, and how they can actually drag down these statistics and what, you know, how many people pass and the views of how we look at this. So when I extrapolated out the first-time test takers versus the ones that have to repeat it, the first-time test taker average is actually pretty good. It's 72%. So the individuals who sit that first time and pass is pretty decent. The repeat time test takers, so if they have to take it twice, 3 times, it jumps down to 28%. So, you know, what can we do as a field to better prepare? Is it that they're not understanding or not great at how to take a test? Is there something that we can better prepare them to sit for that? So on our website, you'll see that the overall pass rates are low. It's 43%. But the only reason for that is because these repeat test takers are really seeming to be dragging down that average. And I found that really, really interesting. And so I went in to some other statistics to see, okay, is it just our test, or is something else going on within this? And I came up with some really interesting statistics. So a behavioral analysis exam, the first time test taker pass rate is 55%. If they have to repeat, 24%. So it almost goes down by double. LSATs, 71%, 25% if they have to retake that LSAT. And then nurse licensure, 80% pass rate, and it goes down to 44%. So there's obviously some type of psychology behind people that have to take it multiple times. If anybody has any ideas or anybody has anything, hey, this I think would really help repeat test takers, I think this is an area that we could all work together to focus on. How can we better enable these technologists for success when they're retaking the test? Is there like a board prep class that we can offer? I know I've spoken with many groups of techs want that board prep. They want to feel secure and like they're ready for it. So many labs will have slightly different operations, and the exam is set for what the ASM standards are. So a lot of labs, a tech will come in and try to sit for the test of what their lab does, and that's not necessarily how they're going to pass that test. And part of the job task analysis, which I found really insightful too, was there was over 500 comments at the end of what did you think was missing, any comments, concerns, anything within this. And it really helps give us a little more insight. Instead of just checking boxes, techs got to explain how they're feeling with things. And I think this tech speaks for a lot of technologists out there. Our field is dwindling. It is getting so dangerous to be a tech. BRPT needs to start a movement to protect techs and patients, or you will continue to see techs walking away from this field. And that is something that I take very seriously as somebody who has shifted and evolved in my own career. I take it very seriously. I have found a lot of really fulfilling work within this field, and I want technologists to feel safe. I want technologists to have those same opportunities that I did. Again, I am open for any kind of advice, any kind of volunteer. Anybody want to volunteer and give help with this? I think we could use all the help we can get with fostering ideas to help protect this field. But one of the things that the BRPT is doing to help is identifying testing areas and domains where technologists struggle and develop ways to facilitate improvement. So there's 4 different domains when you sit for the RPSGT test, and they're under different structures or under different content. And within each one, we can actually identify, hey, you did great in clinical overview, education, and patient support, but the treatment and intervention, you didn't pass that section. So the individuals that are teaching this tech, the individuals that are going back can help them, okay, well then let's focus on that area. What can we do to bolster that, to make sure that then the next time they pass that test? Sleep study preparation and performance, the procedures and guidelines. A lot of techs, again, I mentioned that they do what their lab does. It's teaching them to the ASM guidelines and teaching them to all those, the guidelines that we test on that can make a big difference with them. But something that we are doing now on the BRPT side of things is sending out those performance ratings. And if you are not getting them currently, if you have a school or anything, please reach out and let me know. I can look into that for you and see what we can do for you. Yeah, and someone just put in the comments, also to help protect our career, why are we not regulated like nurses or respiratory therapists are? I'll get to that a little bit more with some of the work that we're doing with the ASM, but that's exactly what we see is respiratory therapists and nurses had to fight a long battle, just like we did. They're just an older field than what we are. But that is on our radar. That is something that we see as important and something that our organizations are banding together to try to figure out. So with that, future trends within this is partnership with key stakeholders to work together to foster this future career path. I've had the great benefit of being able to work with Dr. Jennifer Martin, the outgoing ASM president, the AST president, the Reef Fordyce, and the SBSM, the Behavioral Medicine Sleep Society. We are finally all sitting at the same table, and it's really powerful, some of the things that maybe the other organizations had no idea about. And we're like, to us, it's obvious, and they have no idea. So I think a lot of it is a miscommunication. A lot of it is just we are stronger together and figuring out what we can do to work together. There's also this Choose Sleep initiative with the ASM. It's in the infancy stages with the techs, but you may be familiar with it with the physicians, but they are doing this whole marketing program of even to try to attract sleep physicians to see, okay, why choose sleep? Why is sleep such a great field to be in? And we are working now with them to try to start that for sleep technologists of how can we use that marketing? How can I, you know, advertise to these individuals that this is a wonderful, wonderful place to be. And then we also work with, I'm not sure how many people are familiar with HOSA. It's a future health professionals organization. And it was actually just this past weekend in Texas, I do believe. But it's a global student-led organization whose mission is to promote career opportunities in the health industry. So we have a booth there every year. We advertise, and it's amazing how many young people don't even know that sleep is a career. And I mean, I think all of us have funny stories about how we got into sleep medicine. I don't think we ever grew up thinking, yeah, I'm going to be a sleep tech when I grow up. But I think by focusing on this demographic, I think it helps highlight not only the night tech job, but what else is in our career path too. And what I ask of my audience and ask of anybody is I spend time at local schools talking to parents, talking to kids, talking to high schoolers. This is a field. This is what it looks like. This is your average salary going in it. This is what you'd be doing. And a lot of students are really, really excited about that. They get excited about this possibility that they never even been talked to before. So I would recommend actually approaching your local schools, local guidance counselors, and all that to say, hey, what can we do to get this in that curriculum? All right, so the increase in technology is resulting in uncertainty and change. And I hear that a lot. I think technology is changing and we're evolving, but it's resulting in techs feeling like they don't have a job. Sleep medicine is changing. So what the data is saying, in the US, the number of sleep technology patents has increased by an average of 12% per year over the past decade. And that's not hard to believe. I mean, I think, if you were at Sleep 2023, all the different new items that are out there, as a sleep geek, I love it. I love seeing how we're trying to make sleep better. I love seeing, but it can also be a little bit of a disruptor, right? It changes how we do things. And what we need to understand is that it's growing and it's here to stay. Wearable device markets are expected to grow even more exponentially, as you could see by this graph by Forbes. By 2032, it's going to be almost triple what the size of it is, currently. So what that is telling us is it's here to stay. It's something that obviously consumers want, physicians want, we need in our field. How do we adapt, with it? All right.
Do you want to launch that next poll? Okay.
Rachel's going to do a poll.
Yeah, I just launched it. What are the biggest challenges facing your sleep lab? So we'll give a minute or so for everyone.
What's, what are you struggling with? I think every area has slightly different, or maybe it's going to be, a lot the same.
Yeah, we'll give it a few more seconds to get some more votes. All right, 10 more seconds. Get your votes in. All right, let's see. Let's share the results. There you go.
Yeah, interesting. So 36% with home sleep testing and portable sleep testing, consumer wearables, AI, and automated scoring, providing alternative therapies. And I'm hearing more and more of labs struggling with resources in their area of providing alternative therapies. And then we also have someone that put in sleep tech staffing is the biggest issue, and to the point of, what I reviewed earlier, absolutely. I think, with the decrease and everything. So it's putting our heads together to figure out, okay, we're obviously maybe marketing not to the right group. Maybe we need to start marketing to different groups too, but we're on that. Okay. All right, so again, at the AST 2021 Workforce Survey, they asked the greatest challenges or trends, and it aligns with what you all are answering to. The home sleep testing, portable sleep testing, it's really a trend that's continuing. Consumer wearables are growing. I think having our population more interested in sleep is great, but I think we need to understand how to manage that. All right, and then this, so I created this chart comparing the 2017 job task analysis to the 2022. And we asked our RPSGTs what your primary job responsibility was and how maybe that has shifted. And so patient education was down, which is interesting. And that's just one small slice of what we're seeing. It's not the general patient education, it's just specifically meeting with that patient. But again, this shouldn't surprise anybody. Performing home sleep apnea tests, it changed, it increased in 2022, and facility based sleep studies decreased from 2017 to 2022. And again, that's, that's maybe some part COVID too. I think that shifted things, and I think that made us see what models could work in sleep medicine. But another thing, there was more management, need to define pathways for our RPSGT growth. Potentially it's, there's more management, but is there ways in which we're defining how to get there for techs? And then there's also more technologist education, and then PAP equipment provider. So it's almost like you're seeing this role of a tech shift from being that nighttime doing the sleep studies to doing these other roles within it. And it's not saying that those aren't needed, those are still needed, but you wonder if it's pulling away from some of this, of where we need some techs. We need them spread out too. All these new roles are great and we need them in this, but it's almost like we have too little of people to fill these roles. So we saw this happening, we saw these shifting, and so a group of us got together in 2022 for the AST Workforce Summit, and it was hosted in Chicago, Illinois. And there was, the group of us pictured here, and there were representatives from the AST, ASM, BRPT, behavioral sleep. They had some industry there, including Enzo Data. And they wanted all of us to get together and figure out, okay, these are the trends, this is the survey. What are we going to do to help that? What are we going to see, and where do we see it going, and how can we, as individual organizations, come together to figure that out? There were 4 main topics that were discussed within that, what came out of these surveys. Advancement in HSAT, Laura Lindley and Dr. Khosla presented on that, and Dr. Khosla had brought up a really good point on it. She was saying we almost kind of screwed ourselves a little bit with how we focused on the AHI with the HST, because that insurance companies then saw that was, oh, well, that must be the main point of why we do sleep studies. Well, yeah, I mean, sleep apnea is something that we do treat, but there's a whole broader picture of sleep medicine, as you all know. And you wonder if some of that is, as we're shifting, we're increasing access, but we're also shifting some of the perspectives by insurance. And every change we make, to the point of the individual earlier about insurance, insurance is noticing that, and we make certain changes, and then insurance runs with it, and we need to make sure that we have our voices heard within those insurance companies. Education advancement, we see techs not being able to pass. Someone put the RPSGT exam requirements are proving to be an obstacle. That is something that we hear over and over, and I would love to hear ideas of how can we better facilitate it? How can we better create that we have to have a certain standard going into our field, right? So we don't want to get rid of that. But what can we do to better prepare, and what requirements can we maybe shift to still ensure that we're getting really highly educated technologists, but yet we're allowing them to succeed in this field. And then advancement in AI, things are shifting with that. Sam Rusk, the co-founder of EnzoData, and then Fred Turkington, our SVP of product management, they gave some really keen insights of where they're seeing AI, and then how the sleep medicine field is evolving within it and where we're going together. And then changes in the workforce, myself and then Dr. Scott Williams presented on that, and he was a representative of the ASM. And he talked to the point of how the ASM, how it's facilitating physicians, and how lack of techs is actually stretching physicians so thin that they're not able to do the jobs that they thought they were going to be able to within this. They're stretched very thin. And so we see this, we need to have these techs facilitate different roles, as you saw that switching, but then also fill in the roles that they're evolving from, right? So part of our issue is trying to figure out that. During this summit, though, we again discussed the HSAT wearables. Payers are driving the movement. Labs moving beyond the AHI. I think there's a lot that we could be seeing in our sleep lab or in the overnight diagnostic that we just are not paying attention to. And PCPs are receptive to HSAT. They're increasing access. They're helping our patient base get diagnosed. One of the coolest things that come out with the research on this last ASM meeting was, what can we do with narcolepsy, with diagnosing that maybe without an MSLT? And some of the research that is being done here at EnzoData and with other groups could it be that narcolepsy is much more prevalent and we just don't know, because the MSLT can be very faulty with how we're diagnosing it. I'd highly recommend checking out some of the posters from the ASM conference. They were really interesting to see where maybe we could be going in sleep medicine. The artificial intelligence and technology, software and AI will connect the patient's care journey. I mean, I think as sleep techs, we would get so frustrated. We would take such good care of our patient at night, and then to find out maybe 3 months down the road they're non-compliant, and you're like, well, why did I spend so much time with you? And it's really frustrating. And I think with the help of technology, I think that's gonna really help facilitate that end-to-end care and give that technologist more power to be able to navigate that end-to-end care in an easier way, because we're only one person. We can't do it all. But I think with the help of technology and AI, it really acts as like a toolkit for us to be able to handle much more. So again, what your peers are saying, and this was interesting. Like, what do people want to learn about? What do they feel like should have been on this survey and just wasn't? Knowledge of peripheral arterial tonometry, as WatchPad and HSTs in general are becoming more prevalent, requiring differing knowledge on staging and event scoring. We need more training on reading new type of home studies, WatchPad, sleep ring, etc. So we are finding that techs are, okay, technology is here, right? Where the HSTs are trending, we're going to keep this. Now, what do I do with it? How do I learn this? I don't understand it. And I'll be honest, I didn't work with some of these newer technologies when I was a tech. I've been in the field forever, and I wouldn't necessarily know how to read some of them. And I'm learning myself. I'm learning a lot. And so what can we do? Techs are hungry for this new knowledge. If this is going to be how they're doing their current roles, they need to understand how to do this. AI scoring needs to be addressed, along with how artificial intelligence can help facilitate technologist roles. Instead of it being seen as a scary thing, how can it help me as a sleep technologist? The burden of scoring is hopefully going to be lightened with the advent of AI. I think this is a good thing for us. More opportunities for expansion and engagement among patients we serve. So technologists are seeing this as a benefit. They're seeing this as something that can help them facilitate their roles. And the future trends with technology, so there's a continued explosion of HSAT devices with increased clinical complexity. They're adding EEG and 4-stage sleep staging, cell modem and flow-based devices, so no mobile app needed. They could see right away if a patient failed and use it again that night. Arrhythmia detection, that's really cool to be able to detect if that patient is having any kind of arrhythmia at home. So there's a lot of really cool new advances coming in our field, and not even coming, I mean, they're here. And how does that change our role? What does that mean for us as sleep technologists? Future trends. So where I see this going is you saw the text asking for ways in how do I read these signals? You know, the PPG is a non-invasive technology that uses a light source and a photodetector at the surface of skin to measure the volumetric variations of blood circulation. So what techs are we're finding with this new technology and all of it is they want to figure out, well, how do I read that then? How do I analyze it? You could put a critical eye. We're taught respiratory rates. We're taught all of that stuff. This is a little harder to put a critical eye to. We're not necessarily taught that. I love when I'm talking with groups. I was just talking with a group yesterday who they were taught how to, you know, how to read the PAT signals and all of it. And I loved it. I could have picked their brain forever because it helps us become better techs, because we need to be able to put a critical eye to things. We don't want technology to just come in and do everything, right? We want to still be able to have that clinical eye. But I see a future trend in potentially teaching this of that is where techs are asking for us to go to, is they need us to be able to teach these kind of things. And then technologies are hungry for career growth and education. They really want to see what's next for them. And then, so the greatest growth opportunities, again, is home sleep testing, virtual care, telehealth. You know, someone brought up RPM jobs will explode, and I completely agree. I think I see a lot of techs going into those roles and they are super fulfilled. They have flexibility with their schedules. They are making impact on patients instead of just that one night that they saw them. They're finding that they can really help them make them successful, and physicians need it. Physicians can't see all these patients. And I mean, let's be honest, the physicians I worked with would always come to me like, what mask should I put this patient on? So I think us as techs, we know this. We know what to do with and physicians are relieved, really, truly. The physician group that I worked with in the hospital, they just loved that a tech was in that hospital setting, because they don't want to deal with mask fittings. They don't want to deal with leak. They don't want to deal with any of that. But we do, in a way of like, we want that patient to be successful. So some of this is where do we see these greatest career growths? And you just saw how techs want to learn more about home sleep testing and portable. How can we ensure that the education points around that are still there, that the patients are still buying into their care plan and still buying into their disease state, right? Home sleep testing takes away that 10, 12 hours that we spend with that patient at night and we're educating them the whole time, we're teaching them stuff. If we take that away, they don't always get the importance of it, I don't think. But I think with the greatest growth, like, I think techs can fill that. I think the education parts and facilitating some of these roles for long-term compliance, I think is going to be key. So BRPT sent out a survey in November of 2022, and we had launched a pediatric certification, and we got overwhelming amount of response for it. Techs really love that. And that tells us that you all want to be able to grow. You all want to learn more. You all want to keep up with this. And so out of the little over 1,300 that responded, advanced titrations, you all want to understand how to do them. You want to see, okay, these patient base are more complicated that are coming in. I need to now know a little bit more about it. Sleep coaching was the highest. And again, that's where you look at the RPMs and all those other roles for techs. Excuse me, that's where things are heading. Home sleep apnea testing, and then alternative therapies. So these are the areas that the BRPT is focusing on and working with these other organizations to create educational content around it. We have some really smart individuals in this field who really know their stuff, and we need to better utilize that talent to better teach other techs how to do it, teach the new techs coming into the field how to better adapt to these kind of things. Important tasks or subtasks that people want to see more of. I also found this really interesting. With alternative therapy options, hypoglossal nerve stimulation, phrenic nerve stimulation, and oral appliances, they wanted to see more of that on the test. They wanted to see more of it with what they're asked. They're like, I do this in my job now, which I thought was pretty cool to see how many techs have evolved to being able to do these new type of therapies. And I think that every tech should have exposure to that. I think every patient should have this option in every area, and we're getting there, but techs do want to see more of these alternative therapy options. Advanced titrations, the bi-level, ASV, AVAPs, IVAPs, techs, I think, get a little nervous with that. You know, it's not just a CPAP titration. There's a lot of other missing pieces and a lot of physiological components underneath it that techs need to better understand to better be able to treat this patient population that are now coming into the lab. And they're craving HSATs with new technology. This one individual said home sleep apnea testing is underrepresented or not mentioned enough in this survey, especially PAT technology, which has become what I work with on a daily basis. So we have techs that are no longer working with flow devices. These techs are working with all of these new ones. And are we not even testing on this? Or do we not have enough on it? Is that something that we shift then? So that's something that job task analysis do for us, is we have a group of subject matter experts that come together and discuss all of this. They, you know, see, okay, what do we need to move? Do domains need to shift? Do we need to test more on this stuff? It's a really, really fascinating process, and I would recommend to anybody that wants to volunteer, definitely put your name in for a volunteer on the BRPT website for that, because it's super cool to be a part of, to see what goes into building this exam, to see what goes into what are we teaching and what techs really want. So when I analyzed what all the comments were, what they were asking for, what they are wanting, and an overwhelming amount of individuals, 40%, this critical thinking skill set. And what that encompasses is I took anything that was anything CCSH related. So how to talk to physicians was in there. They're like, you know what, respiratory therapists are taught, nurses are taught, we aren't taught how to get to the point, how to make sure that the physicians get the information they need. Sleep is kind of ignored sometimes in the hospital system, right? And so how do we advance the skill sets of these techs to be able to facilitate these roles? Want to know AI and scoring. That was something, a repeating theme of wanting to understand more, learning more. What does it mean for their jobs? New technology, alternative therapy, and advanced titrations. So that was 23%. So 1/4 of these individuals were craving more education. They want to learn more. They need to know more. Education on sicker patients. There was an overwhelming response of techs saying these type of patients that are coming into this lab, they don't feel as equipped for them. Advanced treatment modalities, ASV, AVAPs, understand purpose of, when and how to use. CO2 monitoring, gas exchange, hypoventilation, they're all critical with the in-lab patients we are seeing these days. When and how to communicate with on-call physician, medical director. I hear from sleep docs taking call from night techs that they wish techs were better prepared for concise patient situation presentation and ask them direct questions. If techs need help at night, they should be able to call their physician, but they also have to understand they need to understand how to communicate in the most effective way to get the results that they need. And what another thing that someone's saying, the sleep techs are ideal candidates for sleep educators, which I wholeheartedly agree. I think our main barrier is communication with the doctors. They still choose RTs, RNs, and even MAs over us. Why? Even though most of those professions cost more to employ to do the same task, they are taught to communicate with doctors in a certain way. Sleep techs are not. And that's something that I had to learn. It was a huge learning curve for me going into the hospital system. I was from an independent lab, and then I became hospital-based but off campus. So I wasn't used to these rhythms. I wasn't used to any of it. And part of what I want to do or create is how can we better equip techs for that? Something that I have always believed in, knowledge is power. Go through it, do the work to put this work in. Something that has been a pet project of mine and a couple other individuals that I work with, the Enso Sleep Scoring Certification. So what this platform allows you to do is go on, and whether you use Enso Sleep or whether you don't, it allows you to go on and score an already scored study and just edit it. So if you don't agree with a certain event, move it around. And the whole goal is to get an 85% agreement or higher with that. And you get a certification at the end. So it allows you to have this sense of pride of, hey, I'm a really great scorer. I know what I'm doing. And it gives you an opportunity to try this out, to see what this new technology is all about. So, I highlighted some of these: improve your knowledge of different types of scoring signals, increase competency in the Enso Sleep Study Management platform, learn how to proficiently review and edit Enso Sleep AI scored studies, and expand your skill set by adapting to innovative AI technology. And it also builds your resume. It's something to put on your resume as new labs are looking, who are already maybe using AI and other things or whatever. Oh, this tech has the experience. They have that breadth of knowledge that I'm looking for. And future trends, learning. How cool, something that an individual that I work with, who is one of the smartest individuals that I absolutely know, is looking at ways in which we can teach to text to score the PPG PAT type for HSATs signals. It gives technologists and physicians more of a critical eye on new technology coming out. It's understanding its uses, benefits, and downfalls. So instead of us just trusting some of these new technologies, it allows us to say, hey, I feel better about that because I now can say this isn't right. Just as we would look over someone else's and argue that's not a high pop, that's an OSA, or I believe that. It's the same thing. It gives us that power to be able to do that.
Andrea, did you want to launch that poll, or did you want to skip it for time?
Yeah, no, that's great.
All right, it is launched. Would you be interested in learning how to score these different signals that Andrea has been discussing?
If I could click, I would put yes.
It looks like the overwhelming majority are clicking yes.
And I love the ones that already know how to score. I think that's awesome.
Mm-hmm.
Might be picking your brain after this.
All right, let's share those results. All right.
Awesome. Okay, so the roles of technologists. So where is all of this leading? We know that technology is changing our roles, right? We see patient monitoring, compliance, sleep scoring, personalization of sleep treatments, coaching. So we see this individuals utilizing that technology, in their own roles. And something interesting that came from the difference in these surveys. So you see the version 2017 and then the version 22 and then what the survey percentage was showing us. So what this is telling us is that, so the clinical overview, education, and patient support is going up by 4.6%. So tech's roles are shifting from the sleep study preparation and performance up to this clinical overview, education, and patient support. So this, when we're looking and facilitating and educating, it's something to keep an eye on of what we're teaching, and to make sure that we're testing on what techs need to know, within their field. Another exciting thing, the CCSH has grown 10% from 2021 to 2022. It does continue to grow. I think when we first released it, we didn't quite have a good grasp on how to use it. And I think a lot of techs got frustrated with that because they're like, well, I got it. My provider's not paying me any more money to have it. I'm not doing anything with it. The coolest part for me is now seeing techs are getting paid more for it. Techs are billing for it. Techs are, being able to do all these really cool roles within it. You'll hear me talk. If you ever heard me, any of my other presentations, I broken record with this, but sleep navigator, sleep educator, and sleep coach. So these are defined jobs now of where we see these roles funneling up under that CCSH. We see the sleep navigator as being more in the inpatient setting for diagnosis and treatment. Sleep educator being in the outpatient setting for like the DME and all of that stuff, compliance, RPM. Sleep coach can also dabble with the RPM and all that, but it's a lot of behavioral analysis too. And something that the Behavioral Medicine Sleep Society is looking at is how to tie that into a career path or stepping stone to go into Behavioral Medicine Sleep Society. We're currently working with a group of psychologists that are trying to facilitate the best practices with that and potentially create a sleep coach credential to be able to create that stepping stone of you need your CCSH to get that sleep coach credential, but it's really that next level of the ones that are maybe doing some form of CBTI and what kind of supervision is needed with that from a psychologist, but better enabling technologists to fulfill those roles. I love this. I feel like I'm doing more good now than I was on nights. Nights served as the foundation for the mass fittings I'm able to conduct by glancing sidelong at a patient's face. I can look at a detailed download from a PAP machine and correlate my experience as a night tech and figure out what a patient needs. And that's exactly, our time on night is invaluable to teach us how to help patients. I feel like we are better because we work nights and had that care with patients in these roles. The future trends for the roles of tech. So I not only see the sleep coach, navigator, educator, but also different preceptor roles and supervising night tech roles, tech to tech educator roles. We've obviously seen that techs are struggling with passing these exams. So maybe we need more mentorship. Maybe we need more of these roles that are helping techs to improve the skills and adapt to a more complicated patient and technology world. And it says how Enso data can help. So part of what I love working here is I see all these problems that sleep technologists are having, and Enso data really listens to it. They really sit and say, well, how can we help with this? There's something that they've developed called real-time scoring. And what that does is it actually scores at night about 7-8 minute lag behind that tech when they're acquiring that study. And so the tech can edit it as they go on the night, and they have certain alerts. So if you input whatever the physician has for your split night, I need an AHI of 20 in 2 hours or whatever they have, you could default it to your lab protocol, and it'll actually ding at you when it's set that. And you could overcheck everything, right, as the night goes on. But I know so many times as a tech, I'd sit there, do I split them? Do I not? Did I get this right? And this is just an extra checks and balances, especially as we see our field taking on a lot of new technologists. I think it's really daunting, and any kind of tool we can give technologists to be better at their jobs, I mean, why not? Physicians are loving the idea of it, because it allows them to feel safer with their patients too in these labs. And something too, it's what different can we alert? Like if a lead is off, is this or that? We all have those nights that we're in with the other patient, and completely, you're watching your other one, but it's just a busy night, right? And this can help a tech, enable them to maybe even take on a little bit more of patient base and feel safer that way. Another thing you kind of saw a little bit, or me talk about it a little bit, on the Enso Sleep Study Management platform. So it's one global report across all sleep software programs. So all the different sleep signals, everything come into this one place, and the Enso Sleep certification that's in this environment And you'll be able to see, to kind of flip through it and to see how great and easy to read it is. But the ASM accredited labs, you need to be able to edit, right? A tech needs to be able to look over these studies, and this platform allows them to be able to do that. I always say work smarter, not harder. When we come in, I mean, the night tech sometimes would tell us, right, oh, I had a really bad patient, or this patient's high, you should probably score this one first, right? What we've created within our platform is you could actually sort by the AHI ascending and find those borderline studies or find the more severe studies. So if you're like, all right, you see down here the AHI 4.1 after Enzo Sleep had scored it, I'm going to review that and say, is that really to where this patient isn't going to be able to get diagnosed, or is it something that maybe they missed some things, right? And then we can add them. It also is, with the addition of total sleep time on this stuff, it offers a more clinically valid, relevant AHI diagnosis too. So what we found was, with adding or being able to tell from the PPG signal whether that patient is asleep or awake on HSTs, that 12% of that patient population went from being negative to being positive, because we know that patients are not asleep all night. We've been in lab studies, we know this. And so what Enzo TST provides is that. So it really helps facilitate us to work smarter and not have to do more tedious work. And then also, to put like that final AHI on there, and that, so with the total sleep time, so it's going to calculate, this is how long that patient slept. Is this study even long enough to be able to bill, right? And this is their AHI. It allows them to expedite certain patients faster, and create a much more efficient workflow. All right, and I know I'm like right at the time. I was trying to hurry through, but that is the end of my presentation.
Thanks, Andrea. Yeah, I don't know if anybody has any questions. We are almost at the top of the hour. We've had a lot of comments come through during the webinar, and it looks like, I know you've addressed some of those, but if anyone, oh, yep, we did get a question if you want to take that one, Andrea.
Yeah, let's see that. Does anyone do in-person RPSGT exam review courses anymore? Although we spend a lot of time working and learning remotely, there still needs to be at least an offer of affordable hands-on training and education for those who don't learn well remotely. Maybe a BRPT approved or AST approved review course. I'm glad that you brought that up, because that's something that I get asked a lot from techs, a little bit of help. I do believe there are ones that are currently being built, so sit tight, but there's something that we are hoping to be able to create to better prepare these techs to sit for these boards. And then let's see, I don't know if there's any, I know there's a lot of good comments in here, but. Okay, we are missing out on HSAT due to having a DME within our hospital system. We have a physician group that does them. Is there any work being done to change the Medicare Stark law, allowing us to utilize HSAT? Well, there's, I think that's a little bit tricky for us to be able to really make any kind of change, because that was put in place to protect certain things, right? What I see groups do is work closely with, the HSAT companies to send these out. But I agree that it can be kind of tricky. You know that you have good intentions, right? Like you're just trying to help that patient population, but you know how insurance and government can be. It's not exactly a quick fix, but that is something that the ASM and AST and us do discuss of different things. Something that is in our docket that actually we petitioned to the New York State for is to try to figure out a way to get more sleep technologists in there with the licensure laws. But I don't know if we have anybody from New York on this call, but they can speak to the fact that there's a big shortage with that. And so we are petitioning for the licensure laws to be lifted a little bit. Right now, you have to have a 2-year education within a certain program in New York even to work. So you couldn't even move to New York and work there. You'd have to do within that. So we are working on that.
There is a question, I think this might be regarding our Enso Sleep scoring certification. Do you have to be registered to be a certified scorer? And if that's not the intention of that question, please clarify.
Yeah. So what we're asking is to have some sort of sleep background. So whether that's CPSGT, RPSGT, RST, RRT, some kind of medical background within the sleep field to be able to sit for that.
Let's see here. I love that people brought up learning to read type 4 HSATs. Where would I look to learn more?
Stay tuned, because that is on my radar. That is one of my upcoming projects here. So stay tuned with Enso Data. Follow me on social media, and I'll make sure to keep you in the loop.
All right. Well, I want to be respectful of everyone's time. We did get another question about maybe missing the webinar. We are going to be publishing the recording on our website next week. So feel free to look for that. We'll send follow-up emails when it's available. We also have a short survey that we'd like you all to complete when the webinar ends. That will pop up on your screen. So we'd love to get your feedback just on some technology and devices and trends that are happening. And then also, we just want to say thank you. Thanks to Andrea for the wonderful presentation, for putting all of this hard work into mining all of this data and interpreting it for us. It's very helpful. And then thanks to everyone that joined. We really appreciate you taking time out of your busy day to be with us. And then thanks again for just everything that you're doing for your patients. We're very grateful to be able to support you. All right. Thanks again. Have a great day.
Bye.